Children may have been exposed to the Ebola virus in the United States. They came into contact with a man who has tested positive for Ebola and is now being treated in the U.S. state of Texas. Those are among the revelations coming to light. CCTV's Daniel Ryntjes joins me here in the studio with more. Daniel, do we know how these children may have been exposed to this man?
Well, the story starts with this Liberian who's now been identified as Thomas Eric Duncan, who, according to the New York Times, had helped a woman who was stricken with Ebola. She was 7 months pregnant, and that was while he was in the capital, Monrovia.
A few days after arriving in Dallas, Thomas Eric Duncan began to develop mild symptoms and went to a hospital, telling a nurse that he'd recently traveled from Liberia. That information wasn't passed on to other medical staff, who decided he probably had a mild virus and should be released. Authorities believe he may have exposed up to 18 people, including 5 children, before returning to hospital with severe symptoms. Anxious parents picked up their kids earlier this week at Hotchkiss Elementary School.
We learned that some school-age children have been identified as having had contact with the patient and are now being monitored at home for any signs of the disease. I know that parents are being extremely concerned about that development, but let me assure these children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms.
The U.S. Centers for Disease Control and Prevention is reassuring the public the chances of an outbreak are minimal. Aid agencies are more concerned the focus is shifting away from the needs of thousands in West Africa.
The world is absolutely not doing enough yet. We're still challenged to outrun the disease. And as long as the new cases continue to increase the way they are, as long as we look around and don't see spare bed spaces in Ebola treatment units, we know we aren't winning yet.